All right. Good morning, everyone. My name is Chris Gallaway. I'm the Executive Director at Friends of Medicare. Thank you so much for joining us this morning. I'm pleased to be here on Treaty 6 territory, joining you along with Daniel and Carly and Erin from the disability community, allies of ours. And we're here today to talk about an important issue, home care. To put it bluntly, our home care system is failing to meet the needs of Albertans. It's failing those seeking care, their families, and the workers in the system. We know that Alberta's population is aging and the demand for home care is growing. Yet in budget 2023, we saw a home care increase that didn't even meet inflation plus population growth. At the same time, the UCP government are getting ready to make major changes to our continuing care system. Their stated goal is to deliver an even greater proportion of care in community. But we're not seeing a corresponding commitment to fund that expansion or improve or provide the additional staffing or the care that would be needed for that kind of growth. Without increased funding, seniors and disabled Albertans seeking care will continually be denied the right to live independently. They'll be required to rely on unpaid labor of loved ones, and they'll have to pay out of pocket for the care they need. As privatization is increasing to for-profit providers, as co-pays are being proposed, access to healthcare through home care is going to become more cost prohibitive, not better. Albertans in need of care deserve dignity and respect. They should not be treated as commodities from which to profit off of. Better funding is urgently needed to expand and strengthen our home care system. That's why we're here today, to launch a campaign to call on the government to prioritize home care, including a new petition calling for an increase in funding to improve the quality and availability of home care services, to improve compensation and working conditions for home care workers, and to provide the resources to support the expansion of home care across the province. People with disabilities, seniors, care workers, and other advocates in Alberta have long called for improving our fractured home care system. Budget 2024 is an opportunity for the government to finally make positive steps on doing so. Before we go to questions, we're going to hear from Daniel and then Erin. They're going to share a bit of their own story and experiences with home care and why this is such a priority that needs to be addressed. So without further ado, I'll pass it over to Daniel, who will share some of his story, and then we'll go on to Erin. Thank you.
I am Daniel Ennett, a four-limb amputee and an emerging filmmaker. I finished my BA honors in psychology in 2020, finishing with first-class honors. I then turned to film to tell stories about the disabled community. I've just wrapped on a CBC series and I've been awarded Telefilm's Talent to Watch to tell stories about the disabled community. Every achievement in my life has been made possible by care work. My ability to function in community is dependent on care work, from basic early morning tasks to getting groceries to working on set. I don't mention these accolades to brag, but to highlight the absurdity that disabled people live with, that disabled people dependent on care work live with. There's no amount of success that will insulate you from the constant threat of institutionalization. For my whole life, my mother has been my primary care worker. She has provided 24-hour care for 30 years. She's 66 years old and has chronic pain. Recently, when transitioning to government care, AHS had evaluated my care needs at 6.6 hours of care a day. This is wholly inadequate for even the most basic tasks. No one could function in a dignified way with only 6.6 hours of time to live their life. It is the opinion of AHS that in the event that my mother is unable to continue doing care work, and I run out of friends and family to exploit for free labor, that I should be institutionalized, because my care needs are unscheduled and too demanding to be met in my own home. The fact of the matter is everyone's life is a series of unscheduled tasks, a point which occupational therapists, doctors, and case managers at home care seem willfully ignorant of. This becomes all the more starkly dehumanizing when my freedom is contingent on the luck of having people around me who care. This is not an infinite font of free labor. My mother has very bad hip problems and chronic pain, and she is functionally unable to continue this labor. Yet still, this government demands that she provides the majority of my care. As a single parent, this has barred her from legitimate employment and stratified her into poverty. The truth is, no one has the astronomical resources required to pay for care work individually, and we are gaslit by the institutions that we fund through taxes. They constantly impose austerity on us, the taxpayers, under the guise of fiscal responsibility. Through this austerity, AHS consistently threatens disabled people's autonomy in contravention of the UN's Convention on the Rights of Persons with Disabilities, and frankly, their own mandate to help people live in community. It's utterly unconscionable that young disabled people have to justify the fact that they deserve to live in their community, supported by the health institution that they fund. The government does not get to double dip from taxpayers by making them do the care work that should be provided by AHS. Disabled people deserve to live in community without the constant threat that if their life circumstances change, they will be thrown into a long-term care facility. This flies in the face of basic fairness and ethics, but we apparently have to remind them of this simple fact. Having a disability is not a sufficient reason to segregate someone out of their community. That is why we are calling for an immediate increase in home care funding to make sure that disabled people, and in ever an increasing senior population, have the resources they need to live in a dignified manner. Thank you.
Hi there, my name is Erin Novakowski. I'm 22 years old and I'm in my 4th year of my bachelor's degree at the University of Calgary, where I'm double majoring in English and political science. I am also a published writer, a disability activist with an online following of over 500,000, and one day I hope to become a high school teacher of language arts and social studies. I've been a full-time power wheelchair user since I was in kindergarten. My disability, called spinal muscular atrophy, is a progressive neuromuscular condition that I was diagnosed with as a toddler. And as a result of it, I require help with most physical tasks, such as getting in and out of bed, showering, preparing meals, getting to class, etc. I have loved learning since I was a little girl. In high school, I was an advanced placement student on honor roll, and I graduated as my class salutatorian. Applying for university was an exciting and a stressful time, just as it was for all of my fellow students. But I have one very vivid memory from this period of my life that I would like to share. It was in this one single moment that I, an optimistic and motivated 17-year-old full of dreams for her future, realized what kind of truly terrifying threat I would live under every day for the rest of my life. In one of numerous meetings with home care in preparation for my transition to adult healthcare services, my family was being told that because my care needs are, quote, so extraordinary, they should expect to have to pay the thousands of dollars monthly, not covered by AHS, for my care forever. And I asked the home care employee that was managing my case, what would happen if my family, or eventually myself, was no longer able to cover that cost? A hauntingly relevant question, as my parents are nearly 70 years old with financial responsibilities and health problems of their own. And without any consideration at all for the gravity of what was being said to me, the worker was quick to answer that I would be placed in an institution. From that moment on, I could never again manage my care or even think about my future without being faced with the very grim fact that I am alive, getting an education, and an active member of my community because of absolute sheer luck. I live every day with a very acute awareness that if I were born into slightly different circumstances, or that if anything about my current situation changes at all, I would no longer have any autonomy over what kind of life I would live. My passion for supporting my community, my interest in learning and teaching, my inherent value as a human being with friends, family, and a partner that I love, none of these things matter at all under the current system of home care. I am never able to focus on what I could become or what I could contribute because I have to focus on finding thousands of extra dollars every month just to keep myself alive. Limited resources should not be used as an excuse or a justification to dehumanize disabled Albertans. It truly, genuinely breaks my heart to think about all of the people who, for any one of an infinite number of reasons, were not as lucky as I have been so far. All of the people who have interests, dreams, talents, and goals that will never ever be recognized simply because the home care system, the very branch of government that claims as its goal to, quote, help people remain well, safe, and independent, has failed them. My greatest hope is that one day we can live in a world where luck does not determine whether disabled Albertans, just like me, will get to experience a comfortable, dignified, independent life. I urge this province to help us make this possible by telling the government that they care about what happens to their fellow Albertans, by telling the government that they must prioritize increased funding to home care services and reorganize the systems that control the livelihoods of disabled people. Thank you for your time and attention.
Thank you, Daniel and Erin, both for sharing a bit of your story. To the media on the call, if you raise your hand, use the raise your hand feature, we can unmute you to ask a question. I also know that folks are available if you want to do a one-on-one interview after this. But I see the media in the room. If you do want to ask a question, you can raise your hand. If there's no questions, we'll move on. And I know that the release and that is in the chat with contact info. There we go. Okay. We'll go to Destiny from Global. You should be unmuted.
Hi, my name is Destiny, and I'm from Global News, as you can see. I was just wondering, what kind of ideas did you have for improving home care access for people? What would your suggestions be for any of those? This is a question for any of you guys.
Does anyone want to jump in on that one? Go to Daniel.
Sure. So there are myriad problems with the way that home care is structured. Particularly, we find that the best solution is an increase in funding to increase the amount of care hours that are available to disabled Albertans and seniors to enable them to live in a dignified manner in community. One of the largest problems with the way that home care is structured has to do with task-based assessments. And this is how occupational therapists come to the allotted care hours that disabled Albertans get. And they are frequently wholly inadequate. So like I said, I get 6.6 hours of care a day. I know these two get somewhere around 8 hours of care a day. But when you think about that in the grand scheme of you're awake for 16 hours, right? What are you doing with these unscheduled tasks where you need to be able to like liaise with your environment, go to work, go into your community, do all these other things that are not as simple as these task-based assessments make people's lives out to be. So for some context, task-based assessments are where a occupational therapist comes and evaluates you and says, okay, well, going to the washroom takes X number of minutes. Eating food takes X number of minutes, and then they compile that into your, hourly allotment. The problem with that is the current caps do not allow for any sort of ethical amount of care.
Absolutely, yeah. Friends of Medicare, we're calling for the increase of funding, looking at those caps and the care hours, and also at the work conditions of the workers. In the system, we have a highly privatized industry with mostly low-wage workers. There's high turnover, there's retention issues. If we're not dealing with the work conditions, we're not going to fix the care conditions. So it's all those pieces. It's the funding, it's the amount of care, and it's who's providing that care. I don't know if anyone else wanted to jump in, or if Destiny has a follow-up question?
I also wanted to add, like Daniel was saying, a lot of the resources to go into yearly evaluations to see if we still need care, but we have permanent disabilities. It's not necessary to put those resources towards seeing if we are still disabled and in need of care, because when it's a permanent disability, that's not going to change.
And I'll follow up with that a little bit. Disabled Albertans live with this kind of constant sort of Damocles hanging over their head that if they get reassessed and, they're making more money, their care hours will get clawed back because the government will say, oh, well, now that you're earning, you're responsible for paying for more of your care. So it keeps us in this kind of cyclical poverty cycle. Further than that, right, we can't live with spouses or family without AHS trying to foist the care work onto those individuals. So if you live with a partner, and this gets into disabled marriage equity quite a bit, but there are lots of small contingent factors in assessment that they will use to claw back your hours and make you more dependent on people who are coerced into free labor, despite being taxpayers and paying for the system that is supposed to be taking care of their family.
Great. I see Destiny a follow up there. If you want to jump in, you should be able to talk.
So you guys were talking about this cycle of poverty and how you guys will, if you earn any money, you have to then pay for care. I understand as a person with a disability, there is a lot of extra costs that come with having a disability, whether that's accessibility tools, mobility aids, and all of that. Could you talk a little bit more about how those extra expenses just add an extra layer of stress and challenge to this whole situation?
So we know from the Canadian survey on disability in 2017 that, disabled Canadians are inundated with extra costs, specifically correlating to severity of disability, because gaining employment and keeping up with regular work hours becomes more challenging. So not only are we stratified from employment, but then we also are inundated with extra costs relating to our disability. So that might be medications, it might be mobility aids, it might be care work. So you're taking a very stratified population and then trying to inundate them with costs that should be provided through home care. Yeah. I was gonna add something. I can't remember what it was. Sorry.
They also as far as I know, AHS doesn't want to, as Daniel was saying, they only want to cover scheduled tasks. So even though I'm trying to be a freelance writer, creator, consultant, they do not want to cover times for my personal support workers to actually help me work, to pull myself out of that poverty cycle.
So yeah, self-employed people, which a lot of disabled people are, don't have another mechanism to fund care work, right? So what AHS likes to do is act like there are other resources available to fund care work that don't really exist. So if you're employed through an employer, then they're supposed to be providing care work for you. But the minute you're self-employed, like I think all three of us are, you know, you don't get any extra support, and AHS is not willing to provide that. So again, it further stratifies us into a lack of employment, which then makes us more dependent on systems like AISH. So again, this cyclical poverty vortex. And Erin, I saw you wanted to add.
Yeah, I was just gonna add, speaking to that sort of stress that comes with the situation, it's really easy to sort of think that once a disabled person has a job, even a full-time job, that there's enough income there to you know, pay for just the regular cost of living as well as everything that comes with being disabled. But for myself, for every hour of my life that I'm alive and I want to have the freedom to go to the bathroom when I want, or get out of my house when I want, or eat a meal when I want. Every hour that I'm, you know, wanting to have those very basic freedoms, I need to be able to afford to pay a care worker living wage. And so, as you can imagine, there's no way to cut back on those extra costs that come with disability. So it's just not possible, and it's not feasible for the government to expect that once we earn enough to maybe pay for rent, that we automatically will also have enough to, on our own, pay for all of the care that we need, all of the medical supplies we need, all of the extra costs that come with, you know, trying not to get sick, trying to keep yourself healthy, trying to be able to, you know, get the therapies you need and the treatments you need to be healthy and comfortable. It's just not possible. But yeah.
Thank you. And so often we see GoFundMe pages for stuff, right? We shouldn't have GoFundMe healthcare to get the equipment and supplies or support that people need. We should provide that as part of healthcare. I'm just looking, is there another hand in the media, or is there another question before we move on? I thought I saw. If not,
I will
I
add
just wanted
one
to say
point.
thank you so much for answering my questions.
perfect. And then
Absolutely.
Daniel, you want to hop in?
Yeah, as far as the Canadian Survey on Disability I was talking about, one of the most interesting aspects of that whole study is that they didn't include institutionalized people or people on reserves in the data collection. And those are far and away the most stratified people in the disability community, right? So all of their poverty statistics, all of their unemployment statistics, all of that is underreported because they have removed from their sample the most stratified people with disabilities.
Absolutely, a good point. I'll do one more call for questions. If not, folks are available to do a one-on-one after if you have more questions about their story or experience. Oh, I'm not sure who reporter 5 is, but you can ask your question.
Thanks. It's Lana Michelin from the Red Deer Advocate. I would like to know a little bit more about this petition that you said that you were starting.
Absolutely. So it is in the chat. It's on our website. It's a petition calling on the government to increase funding to home care and to prioritize using that funding to improve services, expand services, and have the money available for the growth they're talking about in community care. Because right now the budget isn't increasing at a time when the government is stating they're going to have more folks living in community in care instead of continuing care facilities. So we're saying if that's the plan, it needs to be funded, that the system is failing right now, it needs more funding and it needs that attention. So the link should be in the release as well, but it is up on our website right now for folks to sign as of today.
Okay, thanks. And the other question that I had was about what percentage of increase would you like to see in the budget for home care?
We need to see inflation plus population growth plus the predicted increase in use of the system. And then at the same time, and this would be the government would need to cost this out, looking at things like the caps and hours that we've talked about today. The system should provide the care people need, and that should be the full care and support that's needed, not artificial caps on care hours or an expectation that folks pay themselves. So there would need to be some costing of that by the government, because they know the caseload. They would have projections on how many folks they expect to have in community instead of in facilities that they're talking about as part of their continuing care strategy. We don't have that data because the government has not released it. So.
Okay, thank you.
I also want to say we are encouraging home care as a system. Like, we are not saying facilities are the way to go. It just needs to be robust. And it hasn't been working for many years now for, I'd say, any of us.
Absolutely. Was there any other questions in the chat? If not, we'll say thank you for joining us. If you do have follow-up questions, you can reach out. The numbers in the release, and folks are available today to talk further. Otherwise, thank you for joining us for this important issue. And as the months proceed, heading into the budget and the session, you will see and hear more from us on this issue and why it's important. So thank you, everyone, for being here.
Could you send out an email with the petition link?
Absolutely, yeah, we can make sure that that's included.
Thank you so much.
Great, thanks so much. Okay, thanks Daniel, Erin, and Karli for joining us and sharing some of your story and thoughts, and thanks to the media who are here. Have a good day, everyone. Thank you.